Namaskar everyone. Myself Dr. Suprakash Mandal. Today I will be presenting one of the original research finding that was a phase 2 randomized trial to see the effect of yoga on stress and professional quality of life among nursing staff of a tertiary care hospital in Delhi. I am thankful to my guide, Dr. Puneet Misra, who is physician, researcher, teacher, epidemiologist, and public health expert, and also holding the post of professor at Center for Community Medicine, AIMS, New Delhi. He has expertise in public health, epidemiology, holistic health, yoga, vaccine trial, chronic disease, and lifestyle medicine. He has extensive experience on research on yoga, stress, holistic health, lifestyle modification. And under his guidance, we have been implementing community based yoga, translating that evidence of yoga research into the practical interventions in population and also advocacy for lifestyle related interventions. Dr. Mishra's notable expertise and dedicated work has made him a significant influencer in the realm of holistic well-being and public health. I am also thankful to other co-authors for this work. These are some of the glimpses of our work that we have done in our community in that Delhi, northern India. So we have tried to find out the evidence from this 50 minutes of yoga module that we can see here, and we tried to imbibe this practice into community people by teaching them, by guiding them, and by supervising them, thereby synthesizing the evidence on the community based yoga program feasibility, sustainability, and also its beneficial health effect. These are some of the publications that we could achieve. So, coming to the title of this study, that was the phase 2 randomized trial sustainability and effects of a structured yoga program on stress and professional quality of life among nursing staff of a tertiary care hospital in Delhi. We know that stress is a physiological, emotional, and cognitive behavioral reactions, and it is perceived when one person faces any stressor and it acts beyond one's capability to cope up. And it also varies over individual to individual by their perception, coping strategy, or behavior. And over a situation like which is unpredictable, uncontrollable, and the situation is demanding something extra, and at any workplace, stress has become an important occupational health hazard also. Healthcare providers, especially nursing staffs, they suffer from variable level of stress which can be acute as well as chronic. Apart from that, high level of burnout, low professional quality are also seen. We have found that the stress level among these nursing staff were around 87% in India, reported by few of the studies, and burnout of 30%. And this type of high burden of burnout stress leads to deleterious effects on their personal as well as professional life and also sometimes social life. We know that chronic stress, it actually has some deleterious effects on endocrinal, cardiovascular, and autonomic system. It also found to de- decrease the immunity who are going to get chronically stressed. And at workplace and personal level stress, it also have negative impact on the pregnancy as well as the fetal health. We have also seen some of the studies that are reporting that increased hospital acquired infection, wrong medication, miscommunication between the patient and the health worker have been found under high stressful situation. As well as apart from that, the high economic burden due to the absenteeism, health cost of employee, they are found in that health sector. And also by compromising the quality of care. It also indirectly increases the health cost whenever the health worker are chronically faces any type of stress and burnout at workplace. We know that yoga is a type of mindfulness activity, and it unites our body, mind, and spirit. It promotes complete well being through a balance of movement, breathe, and mindfulness. It increases the flexibility, strength, and also deepens the self awareness and fosters inner peace and balance. There are a lot of promising evidence that showed that yoga can decrease the stress, manage burnout, and it can prevent different types of common mental health issues, as well as it can also treat different mental health problems. But in spite of it, the application of yoga at workplace as well as the sustainability of regular practice is really low, and there are some poor evidences. That's why as we attempted to see the effect of yoga at workplace as well as to find the sustainability of this yoga program. So here we measured the effect of yoga on perceived stress level and professional quality of life, and we followed up the participant up to 6 months. This study was actually a part of a small scale phase 2 randomized trial. The 3 months finding has already been published. So here we are actually reporting the 6 months follow up with the sustainability component. So the study setting was a tertiary care hospital situated in northern India. The study population was the willing nursing staff of various departments. Randomization was used by variable block randomization to divide the study willing participant into two equal halves, where the first half was the yoga groups who were provided supervised structured yoga at the workplace in a dedicated yoga studio, whereas the second group was kept under wait list for initial 3 months. These were the outcome variable. We can see the basic socio-demographic workplace variables. We also tried to find out some objective variable of stress like serum cortisol, C-reactive protein, and the subjective stress and professional quality was measured by validated perceived stress score, professional quality of life score. The interventions for the initial 12 weeks was 50 minutes of your structured supervised yoga session twice in a week for 12 weeks. And whereas that control wait list control, they didn't do any yoga in the initial 3 months. And in the second phase, after the 12 weeks, the yoga group they were requested to continue their practice at home, while the waitlist controlled group they were provided the 12 weeks of twice in a week 50 minutes yoga session at the workplace in that dedicated yoga studio. We summarized the data using mean, standard deviation, and 95% confidence interval for the continuous variable, while frequency and percentage for the categorical variable. We compared the data at the baseline and at the end line, that is 6 months. We used the unpaired t-test for the normally distributed variable, continuous variable, or Wilcoxon-Ransom test for the continuous variable who are non-normally distributed. We also compared the categorical variable with the help of the chi-square test or Fisher-Exact test wherever applicable. We took level of significance as at zero point zero 0.05. So here we can see the concert flow diagram of that study participants from the beginning of the study till the 6 months of follow-up. Here we can see during we assessed for eligibility for 117 participant, those who were willing to participate. Out of them, 4 were excluded due to these reasons, and we got consent from 113 participants, and they were randomized with the help of the randomized sequence, maintaining the allocation concealment with the help of the opaque sealed envelope. So initially 58 participants were allocated in group A, that was the yoga group, and 55 participants in the group B, that was waitlist control group. And out of this 55 of group B, three participants, they didn't complete the assessment form, and they never came back with that complete assessment form, so we had to exclude. So ultimately 58 participants of group A and 52 participants of group B, so total 110 nursing officers were enrolled in that study. And at the end of the 3 months of follow up, we can see that 36 participants in the yoga group and 32 participants in the follow waitlist control group were found to be remaining in the study. Whereas after the 6 months, total there was 23 participants in the yoga group and 26 participants in the another waitlist control group who were actually given yoga during that second phase remained in the study. So we analyzed 23 participants, those who did 3 months of yoga at the facility and 3 months of yoga at home, whereas the 26 participants who didn't do any yoga during the initial 3 months, but the later 3 months they got supervised structured yoga at workplace. After the analysis, we found that all the baseline variables were comparable between the two groups, and whenever we compared the perceived stress scale score at baseline, we can see there was no significant difference. At 6 months, there was no significant difference found. But the pre post analysis, we found that from the baseline to 6 months, the yoga group had significant difference or significant reduction of the mean perceived score in that yoga group, as well as in the waitlist control group also showed that significant reduction of the perceived stress scale score. In the 3 months analysis, which we reported in the published article, we found that at the end of the 3 months, there was significant reduction in the yoga group's perceived stress scale score, but not in the waitlist control group. So at the end of the 6 months, we found both the group after receiving that yoga, there was significant reduction from the baseline. Whereas for the professional quality of life scale, it had three components. One is compassion satisfaction, secondary traumatic stress, and third one is burnout. Though we could not see any significant difference or change from the baseline to the 6 months follow up, in the burnout component, we could find that there was some significant difference between the two group A and group B, where group A had little bit lower burnout score. Whereas for the other objective parameter, that is lab parameter, serum cortisol and high reactive C reactive protein, high sensitive, so we could not find any significant difference from the baseline to the follow up. Maybe though there was some reduction in that group A and group B also, but in case of serum cortisol, but it was not significant. For the high sensitive C reactive protein, there was no significant difference from the baseline to the follow up. Maybe this can be due to the low sample size. So for the conclusion, we can see that nearly half of the participants, they could maintain the practice at the end of the 6 months. Therefore, the structured supervised yoga had sustainable effect on the practice, as well as since there was significant reduction of perceived stress score, we can conclude that the effect was also sustainable, especially in case of group A participant who did 3 months of home practice at the second phase also. However, the home practice group, they had higher loss to follow up than the supervised yoga group. So, therefore, we can see that structured supervised yoga group had a higher compliance compared to that home practice. The recommendation from this study will be that structured supervised yoga can be one workplace solution to beat stress, burnout, and to tackle the common mental health issues of health workers. However, further study with a larger sample size and more intense follow up may be done in future. Here I will conclude my presentation with one sloka, that is sloka number 17 from Srimad Bhagavad Gita, which actually tells that yoga, which destroys all sorrows, removes all bondages, is successfully practiced by the one who is tempered in eating and moderate in movements and recreation, temperate in action and temperate in sleep and wakefulness. Thank you.